Hey everyone, welcome back to all my listeners. This is episode 10 in season 18. Today is Wednesday, August 12th, 2026. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Well, all right, you guys, you know the month of August is quickly flying by. It is already the second Wednesday of the month, and you know it is going to highlight the OIG Work Plan updates for the month of July 2026. And in my trusty tip, I'm going to go ahead and go over some great examples, in my opinion, on provider enrollment for teleradiology. And I'll go ahead and close out and round out today's episode with a remarkable quote by Nita Ambani. All right, you guys, let's get into it. So in today's Newsworthy, the month of July's OIG Work Plan updates. There are 13 updates made to the OIG Work Plan for the month of July 2026. Now, there are a total of 5 projects and 8 series. Now, the first work plan update is titled Savings in Medicare Hospice Payments for Care Provided in Nursing Homes. Now, this report will be coming from the Office of Evaluation and Inspections. The fixed daily rates that Medicare pays hospices for routine home care provided in a nursing home include personal care services. However, nursing homes are already required to provide personal care services to their residents. Paying the hospice the full routine home care rate that covers personal care services when these services are already required from the nursing home can undermine the efficiency of Medicare payments and add to the incentives that bad actors have to exploit the program. This review will determine Medicare payments for routine home care provided to hospice beneficiaries in nursing homes, estimate potential cost savings from reducing the payment to address the inefficiency in the payment structure, and examine practices of hospices with a high percentage of their beneficiaries in nursing homes. Now, there is no timeline indication for the final report expectation. Now, the second OIG Work Plan update made for the month of July 2026 is titled Audit of HHS Governance of Artificial Intelligence. Now, this report is expected from the Office of Audit Services. HHS has been deploying artificial intelligence, or AI, tools to support mission-critical functions, including public health surveillance, fraud detection, and administrative automation. Now, given the growing reliance on AI, it is important that HHS fully establish and implement a comprehensive AI governance framework to manage risks, including cybersecurity risks associated with AI systems. Federal requirements, including the National Institute of Standards and Technology AI Risk Management Framework, outline key principles for responsible AI use, including transparency, fairness, accountability, security, and privacy. OIG will conduct an audit to determine whether HHS has established AI governance for the development and implementation of AI tools in accordance with federal and HHS requirements and guidelines. By identifying risks and areas needing attention, HHS can strengthen controls and support more effective use of AI. Now, there is also no timeline indication for the final report's expectation. Now, moving on, the third OIG Work Plan update made for the month of July 2026 is titled Nationwide Analysis of Antipsychotic Drug Use in Nursing Homes. Now, this report will be coming from the Office of Evaluation and Inspections. The overuse of antipsychotic drugs presents a risk to nursing home residents, particularly those with dementia. These drugs are not approved to treat dementia, and the Food and Drug Administration, the FDA, has warned that they may increase the risk of death for these individuals. OIG has long-standing concerns about the overuse of these drugs in nursing homes. OIG's recent review of nursing home inspections found that nursing homes gave antipsychotic drugs to residents to manage their behavior for the benefit of staff. OIG will conduct a nationwide analysis to determine the extent of antipsychotic drug use among Medicare beneficiaries in nursing homes, including the extent to which those beneficiaries had a dementia diagnosis. Now, again, there is no timeline indication for the final report's expectation. The fourth OIG Work Plan update made for the month of July 2026 is titled Trends, Patterns, and Key Comparisons Related to Medicare Home Health Agency Provider Enrollments. Now, this report will be coming from the Office of Audit Services. Recently, federal and state oversight bodies have raised concerns about the rapid expansion of Home Health Agency, or HHA, provider enrollments and patterns that may indicate deficiencies in CMS's provider enrollment oversight. OIG's preliminary analysis shows notable increases in HHAs in certain states, contrasting with declining home health payments nationwide, and suggests that existing controls, such as moratoriums and prepayment reviews, may not be applied where needed. This data brief will analyze HHA provider enrollment information, Medicare claims data, and population data from 2015 through 2025 to identify trends, patterns, and geographic differences that may signal weaknesses in the enrollment process. The results will provide CMS and other stakeholders with information needed to assess potential vulnerabilities and consider oversight actions to address emerging risks. The objective will be to identify trends, patterns, and comparative data that indicate potential vulnerabilities in the Medicare HHA provider enrollment process. Now, again, there is no timeline indication for the final report's expectation. Now, number 5, the 5th OIG Work Plan update made for the month of July 2026 is titled Series CMS Financial Statement Audit. Now, this report will be coming from the Office of Audit Services. The CMS Financial Statement Audit determines whether the annual financial statements present fairly, in all material respects, the financial position of CMS. The financial statement audit is required by the Chief Financial Officers Act of 1990, as amended by the Government Management Reform Act of 1994, and performed in accordance with generally accepted government auditing standards and current Office of Management and Budget guidance from the audit requirements for federal financial statements. Now, OIG will retain an independent external auditor and review the independent auditor's work papers to determine whether CMS's financial statement audit was conducted in accordance with federal requirements. In addition to overseeing the financial statement audit, OIG will perform related work to assess internal controls, compliance, and other factors affecting the reliability of CMS's financial reporting. There is one project in this series, and the series completion is expected in fiscal year 2028. Now, the 6th OIG Work Plan update made for the month of July 2026 is titled Indian Health Services Administration of Contract Support Costs. Now, this report will be coming from the Office of Audit Services. The Indian Health Service, or IHS, provides funding known as Contract Support Costs, or CSCs, to pay expenses incurred by tribes in connection with the administration of healthcare programs under the Indian Self-Determination and Education Assistance Act. Now, OIG's audit will provide an overview of how IHS administers CSC funds, describe the process for determination, payment, and reconciliation of CSCs, and identify trends for CSC expenditures and claims submitted for payment during fiscal years 2024 through 2026. In a separate audit, OIG will determine whether CSC expenditures complied with federal and program requirements. Again, there is no timeline indication for the final report's expectation. Now, the 7th OIG Work Plan update is for another series, Audit of OpDiv's Contract Closeout Process. Now, this report will be coming from the Office of Audit Services. As one of the largest contracting agencies in the federal government, HHS performed contracting actions, or award and modifications, totaling $38.5 billion in fiscal year 2023. Now, prior OIG work identified issues with HHS contract closeout processes and procedures that are required after a contracting officer receives evidence of completing a contract. Now, the closeout process involves, number 1, ensuring that goods and services are provided as intended. Number 2, validates final costs and payments. And finally, number 3, frees up excess funds for possible use elsewhere. OIG will determine whether selected operating divisions closed contracts according to federal regulations and HHS policies and procedures. There are 2 projects in this series. Project titles will remain unpublished until projects are complete and reports are posted. The series completion is expected in fiscal year 2028. Now, the 8th OIG Work Plan update is again for a series, Series, National Institutes of Health Grants Recipients' Compliance with Federal Cost Requirements. Now, this report will be coming from the Office of Audit Services. The National Institutes of Health, the NIH, funds research activities intended to advance understanding of human diseases and related health conditions. The research project, or R01, is NIH's most commonly used grant program for independent research projects. In fiscal year 2025, overall funding for R01 equivalent grants, which include R01 grants, reached $20.84 billion, representing a 4.1 increase over the prior year. Because these awards represent a significant federal investment in research conducted across a wide range of recipients, ongoing auditing is essential to ensure that funds are used in accordance with federal and award requirements. Using a risk-based approach, OIG will conduct a series of audits of selected recipients to determine whether they used NIH funding in accordance with the terms and conditions of the grants and applicable federal requirements. There are 3 projects in this series. Project titles will remain unpublished until projects are complete and reports are posted. Series completion is expected in fiscal year 2028. Now, the 9th item on the OIG Work Plan for July 2026 is for another series. CDC's Public Health Infrastructure Grant Recipients. Now, this report will be expected from the Office of Audit Services. The Centers for Disease Control and Prevention, the CDC, their Public Health Infrastructure Grant, or their PHIG, is a 5-year award that, according to the CDC, was designed to be flexible so that health department recipients can invest in people, in services, and in systems that address their community's most pressing needs. CDC developed these awards to address gaps in core public health capacity and infrastructure at the state, tribal, territorial, and local levels. From fiscal year 2023 through fiscal year 2025, CDC awarded PHIG funding to 107 jurisdictions, including all 50 states, 22 cities, 27 counties, and 8 territories and freely associated states, as well as 3 national partners. As of December 2025, CDC awarded a total of $5 billion in PHIG funding. Using a risk-based approach, OIG will conduct one or more audits of selected recipients to determine whether they used PHIG funding in accordance with federal and award requirements. There are 2 projects in this series. Series completion is expected in fiscal year 2028. Now, the 10th item on the OIG Work Plan for July 2026 is another series. Title 4E Adoption Assistance Program Payments. Now, this report is expected from the Office of Audit Services. The Adoption Assistance Program, authorized by Title 4E of the Social Security Act, provides federal matching funds to states to facilitate the timely placement of children whose circumstances would otherwise make them difficult to place with adoptive families. The Administration for Children and Families administers the program. Federal funding, which is contingent upon an approved state plan, is available for a one-time payment to help with the costs of adopting a child, as well as for monthly subsidies to adoptive families to help with the care of the eligible child. In federal fiscal year 2023, 50 states, the District of Columbia, Puerto Rico, and federally recognized tribes were awarded Title 4E adoption assistance payments of nearly $3.4 billion, supporting over 560,000 children monthly. Using a risk-based approach, the OIG will conduct one or more audits of selected states' adoption assistance program payments to determine whether states complied with federal and state requirements when claiming adoption assistance payments for federal reimbursement. There are 6 projects in this series. Project titles will remain unpublished until projects are complete and reports are posted. Series completion is expected in fiscal year 2028. Now, the 11th item on the OIG Work Plan for July 2026 is another series. State agencies' compliance with requirements for children in foster care placed in qualified residential treatment programs. Now, this report is expected from the Office of Audit Services. Title 4E of the Social Security Act established the federal foster care program, which provides funding to states for safe and stable out-of-home care for children who meet certain eligibility requirements. The Family First Prevention Services Act of 2018 created a new category of child care institutions called Qualified Residential Treatment Programs, designed to address the needs of children with serious emotional or behavioral disorders or disturbances. The OIG plans to perform audits of selected states to determine compliance with federal and state requirements related to children in foster care who were eligible for assistance under Title 4E of the Social Security Act and resided in qualified residential treatment programs. There are 3 projects in this series. All reports are expected to be finalized, and series completion is expected in fiscal year 2027. Now, the 12th OIG Work Plan update for the month of July 2026 is another series. Audits of Child Abuse Prevention and Treatment Act state grants. Now, this report is expected from the Office of Audit Services. Abuse and neglect against a child younger than 18 years old by a parent, caregiver, or another person in a custodial role can have a long-term impact on the child's health, opportunity, and well-being. The Child Abuse Prevention and Treatment Act, or CAPTA, provides funds to assist states in child abuse and neglect prevention, assessment, investigation, prosecution, and treatment activities. In federal fiscal year 2022, the Administration for Children and Families awarded $91.6 million in CAPTA state grant funding to 50 states, the District of Columbia, and Puerto Rico to improve their child protective services. The funds were distributed based on the relative share of the child population younger than age 18. Using a risk-based approach, the OIG will conduct audits of CAPTA state grant funding to determine whether awardees complied with federal and state requirements for the intake, assessment, screening, and investigation of reports of child abuse or neglect. There are 7 projects in this series. Project titles will remain unpublished until projects are complete and reports are posted. All reports are expected to be finalized, and series completion is expected in fiscal year 2028. And the 13th and final OIG Work Plan update made for the month of July 2026 is another series. Skilled Nursing Facility Reimbursement. Now, this report is coming from the Office of Audit Services. A skilled nursing facility, or SNF, is a nursing home that provides skilled nursing care and rehabilitation services such as physical, speech, and occupational therapy to beneficiaries who need assistance after hospitalization. In October of 2019, the Centers for Medicare and Medicaid Services implemented a new payment system for determining Medicare Part A payments to SNFs. Specifically, CMS implemented the Patient-Driven Payment Model, or PDPM, a new case mix classification system for classifying SNF patients in a Medicare Part A covered stay into payment groups under the SNF Prospective Payment System. Under PDPM, payment is determined by factoring in a combination of 6 payment components. 5 of those components are case mix adjusted and include a physical therapy component, an occupational therapy component, a speech-language pathology component, a non-therapy ancillary services component, and a nursing component. Additionally, there is a non-case mix adjusted component to cover utilization of SNF resources that do not vary according to patient characteristics. The OIG will determine whether Medicare payments to SNFs under PDPM complied with Medicare requirements. There are 8 projects in this series. Project titles will remain unpublished until projects are complete and reports are posted. All reports are expected to be finalized, and series completion is expected in fiscal year 2028. And now it's time for my best practice tips in Trusty Tip. NGS, or National Government Services, the MAC in my region, put out some great information on their website that they're now sharing with WellPoint Federal. Now, this great information is for provider enrollment, teleradiology scenarios. So I'm just going to read to you what this article states, and I think it's really, really good for our providers who are trying to enroll for these specific types of services for teleradiology. Now, Section 1834M of the Social Security Act specifies the circumstances under which Medicare makes payment for services that are ordinarily furnished in person, but are instead furnished via two-way telecommunication technology, or via telehealth. Now, CMS's long-standing interpretation is that services are not ordinarily furnished in person, such as care management Remote monitoring and remote interpretation of diagnostic tests are not included in the statutory definition of Medicare telehealth services. However, teleradiology refers to the electronic transfer of radiological images, such as X-rays, CT scans, and MRIs, from one site to a radiologist situated at a remote location for interpretation and reporting. Now, in bold, the article states, quote, "Since these services are not typically provided in person, they do not qualify for telehealth flexibility. A teleradiologist must be enrolled in the state corresponding to the location where they are physically present while performing the service," end quote. So keep that in mind as I continue reading from this great update that they posted on the website. If the teleradiologist is working from their home, that address must be listed as the practice location. Again, this is for my specific MAC jurisdiction for NGS. Again, I am outside of the Chicagoland area, so the state of Illinois falls into the NGS jurisdiction. Let me continue. A physical office cannot be substituted if it's not where the interpretation and reporting occur. Now, they give 3 situations here. Number 1, the provider has a private practice, no reassignments exist. So they go over several examples of this situation. Dr. Smith interprets tests from his home in Maryland. Another scenario, Dr. Smith submits a CMS 855I to the Maryland MAC and lists his home address on the application. Another scenario is Dr. Smith selects the practice location type as business office for administrative telehealth use only, or home office for administrative telehealth use only, to prevent his home address from being published on Care Compare. And finally, claims will be paid based on Dr. Smith's home location. So those are great scenario examples where the provider has a private practice and no reassignments exist. Now, NGS goes on and talks about another category of examples where the provider reassigns to a group in the same state. Now, here the scenario is Dr. Smith interprets tests from his home in Maryland for Jones Medical Group, which is also located in Maryland. Another scenario, Dr. Smith submits a CMS 855I to the Maryland MAC to reassign to Jones Medical. Again, no location is listed, all locations on the CMS 855B. And then another example is that Jones submits a CMS 855B to the Maryland MAC listing Dr. Smith's home address as a practice location. And then Jones selects the practice location type as business office for administrative telehealth use only or home office for administrative telehealth use only to prevent his home address from being published on Care Compare. And finally, claims will be paid based on Dr. Smith's home location. And then that last grouping that NGS includes is for the provider reassigns to a group out of state. Here, Dr. Smith interprets tests from his home in Maryland for Jones Medical Group, which is in Florida. Dr. Smith then submits a CMS 855I to the Maryland MAC to reassign to Jones Medical. There's no location listed. All locations are on the CMS 855B. Then Jones submits a CMS 855B to the Maryland MAC listing Dr. Smith's home address as a practice location. Then Jones selects the practice location type as business office for administrative telehealth use only or for home office for administrative telehealth use only to prevent his home address from being published on Care Compare. And then again, claims will be paid based on Dr. Smith's home location. And finally, the caveat, there's always a note, right? Note, this scenario is consistent with section 10.3.1.4E from the Interjurisdictional Reassignments of the Program Integrity Manual, or the PIM, Chapter 10. And finally, in this week's inspiring quote in Spark is from Nita Ambani. The lotus comes from the murkiest water, but grows into the purest thing. Absolutely true, right? I love this quote on change, on transformation, as seen from the beauty of lotus flowers. Their growth from muddy waters into stunning blooms have long inspired humanity as powerful symbols of resilience, of purity, and of personal growth. Today's spark serves as your reminder to stay grounded in a chaotic world without letting negativity or corruption stain your inner peace and true identity. I'm happy Nita Ambani's spark burns brightly and can still inspire so very many. All right, you guys. Well, that wraps up today's much shorter and sweeter episode. I hope you guys got a lot out of these newly formatted OIG Work Plan updates. I know they are in the beta stages and require some feedback from those of us that do peruse the OIG Work Plan from month to month as I do. I know I'm planning on sending my feedback in on what could use improvement, on what is fantastic. I also like the teleradiology provider enrollment fun facts for the NGS region here in my area. So there's lots to consider when you research your local MAC websites. And I know I will be sharing that information with my specific clients that I have in the region. I know it will be very, very timely, very, very useful. And I will also include these updates when I am speaking nationally for matters that involve telehealth types of services. So always wonderful news that you can peruse through your own local MAC web pages. They are all rich with resources, rich with information on how to keep you compliant and how to keep your practices current. So, all right, you guys. Well, I hope you are going to enjoy the rest of your week ahead. I hope it is simply fantastic. You've got a lot going on. I know I do. So very busy in the next coming weeks from all of my speaking engagements, all of my education sessions that I deliver, not only to professional colleagues, but also through national conferences, but of course in the everyday work that I do for my clients, for my various specialty providers. So I hope you guys are taking time to unpack at the end of your busy, busy work weeks. All right, you guys. Well, thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.